Hi, I'm Nurse Barb and this is your Daily Dose. Today we're going to do something a little different and talk about our vaginas and our vulvas. And to make it easier, so we don't have to have a mirror and do some contortions, I brought along my vagina and vulva puppet. So this is something that we use as health and sex educators to help women understand what's going on inside their body. And this outer part here, this is red velvet, and this is meant to show you the outer labia or the labia majora, which protect the inner labia here, the labia minora, and that protects the vaginal opening. Now, both of these all encompass the entire genital or vulvar region. Here you see the clitoral hood that's meant to protect the clitoris, which is here. And again, this is not to size, this is not to scale, but just underneath the clitoris is this little rosebud, and that's meant to show you the urethra, or where urine leaves the body. Underneath, you see this material that's kind of folded up. This is meant to show you the vaginal rugae, or the folds that are inside the vagina. And the vagina has these accordion-like folds that expand and contract. So the vagina can become much more widened, right? It has to accommodate a baby's head coming through. It also needs to accommodate tampons or partners or even toys. And these rugae are amazing because they can expand so that women are able to give birth to a baby. So the vagina is a very complex, perfectly balanced area of our body, and we want to keep it healthy. One of the most important things to remember about the vagina is that there are a lot of hormone receptors around the labia majora, the labia minora inside the vagina, around the clitoris and the urethra. And those hormonal receptors are very thirsty. And when they're working well and you have plenty of hormones in your body, then there's good metabolism of the cells. And the cells are plump with collagen. They can take some friction. Let's say you're going to a yoga class or you're exercising and your clothes are rubbing on this delicate skin. It doesn't break down. It doesn't develop a rash. As we get older, as women, and our estrogen levels drop, this area can become quite dry, and we'll talk about that in another video. But what's also important to know is that when we have plenty of good hormones in this area of our vulva and our vagina, then we have good metabolism of glycogen, and that promotes the lactobacilli. That's the normal healthy bacteria that live in our vagina. They're known as the vaginal biome. When we have a happy, healthy vagina, we have plenty of lactobacilli here. And those lactobacilli keep the pH very acidic, and that prevents the overgrowth of harmful bacteria. How would you know if you have enough lactobacilli? Well, you really know when you don't have enough. So if you notice a strange odor coming from your vagina, like a fishy odor, or you're having itching or irritation, or a discharge that looks a little yellow or a little bit green, that's the time to talk to your healthcare provider, because it may mean that things in the vagina are out of balance. Usually these are very, very easily treated. So the vagina and the vulva here also have a lot of androgenic receptors. Those are male type hormones. You're probably familiar with testosterone and DHEAS. These are androgenic male type hormones that women have in their body all the time, but because we have them here, they can impact sexual satisfaction. So there's a lot of complexity to this area. One other thing I want to mention is many women have discomfort around the vaginal opening right here at the bottom. Let's say if you think about this as the face of a clock, at 6 o'clock, many women have discomfort when they're having to insert a tampon, or maybe they're having intercourse. If that's the case, consider using a lubricant. And if it continues, even with a lubricant, do talk to a healthcare provider about that. Some women have chronic pain in this area, known as vulvodynia. That's a topic that we're going to cover in another video. So again, this is representation of the vulva. Again, the labia majora, labia minora here, open to the vaginal opening. We have the rugation, or the accordion-like folds, the urethra, the clitoris, and the clitoral hood. It's important to know that what goes on in the vagina doesn't just stay at the vagina. It also impacts the urethra and the urinary tract. Behind this puppet, you can't see, but there's a whole group of muscles known as the pelvic floor muscles. And when women are strong and they're activating those muscles, they can contract them and they can close their vagina off. They can also close off the urethra so they don't leak urine. So when we think about the health of our vulva and our vagina, it impacts both the vaginal area and it also impacts our urinary tract. Now, I hope this has been helpful. We're going to talk more about this, and I'll bring my puppet back again. If you have more questions, you can always go to nursebarb.com. And I hope this video has been helpful. And if you like it, please click like and subscribe. Take care and be well.